Our whole focus at Southwest Hearing Center is to make sure that our patients who have hearing loss are able to participate actively in their lives as if they never had a hearing loss. So in order to do that, we need to find out, what is the patient's lifestyle like? What are their relationships like with family and friends? And how is their hearing loss impacting their relationships with others? Is it a challenge with hearing and understanding family members? Do you like to travel and you're having difficulties hearing and understanding others around you? And from there, we also find out what types of health issues might be impacting their hearing loss. After we obtain a complete case history of the patient, and also receive input from the patient's spouse, significant other, their children, or friends that may be attending the visit with them, we then evaluate their hearing so that the hearing evaluation results, combined with their specific challenges that they're encountering, and also their financial situation, all of that plays a role in determining what type of technology would be best for a patient. When we perform the hearing evaluations in a sound-insulated environment, in a sound booth, we're able to determine what is the type of hearing loss that the patient has. What is the severity of the hearing loss? How well are they able to recognize speech sounds? How well are they able to distinguish between speech sounds? We will perform a tympanogram and acoustic reflex measurements. This gives us an idea of the integrity of the patient's middle ear system. After we do that, we perform a pure tone hearing evaluation by both air conduction with the earphones over their ears and by bone conduction. That's by hearing the tones through the vibrations of their skull. That gives us an idea as to whether or not the hearing loss might have medical causes. Additionally, we will verify the pure tone tests by conducting a speech reception threshold evaluation. That's the softest level that the patient is able to detect speech to be present. We then perform an auditory speech discrimination test or word recognition test, and that gives us an idea on how well the patient is able to distinguish between speech sounds. And it will enable us from there to determine what type of device would be most appropriate for them. Is the hearing device too small for them to be able to insert in the ear on their own? Or do we need to have a device that's larger for them? There are now hearing devices that will connect with our smartphones without any other accessory. They'll connect with our television set, enabling us to connect to the outside world. Not every hearing device is the same. Over the past 30 years that I've been an audiologist, I've had an opportunity to work with nearly every manufacturer of hearing device. As far as technology, as far as repair records, there are many types of hearing devices. Some types of devices are more appropriate for a person's hearing loss than others. So when we take a look at the patient's individual needs, we will always select a hearing device from a manufacturer that is reputable, that has technology in it that will enable the patient to hear clearly and distinctly in their various listening environments. When you come to either of our offices, whether it be in Phoenix or in Scottsdale, you can rest assured that you're going to be working with university-trained audiologists who have doctorate degrees in their profession. Your hearing will be evaluated properly and help you select devices that are best for your lifestyle and for your pocketbook.